All right. Hi, I'm Dr. Isom.
Hi, I'm Tammy Hernandez.
And this is NeuroReal. So tonight's episode is Treat the Brain and Not the Label. What ADHD and autism really need. So let's get into it.
Okay. So I wanted us to touch base on, and kind of clear up some confusion that may be happening. When I have clients that walk into a mental health counselor and, we're thinking, oh, mental health, my child or whoever is depressed and anxious. And then the first thing I'm going to tell them is, I think we need to have you go to a doctor, right? And so I wanted people to understand why I might do that. And so I thought if you can let us know what it is that you do when, say, one of my clients would come to you and, they've come to me for autism, ADHD, and then I'm sending them to you, right? And kind of explaining what you do and what that visit looks like, right, for that assessment.
I think for most people, they don't realize the importance of having a physician, especially if they're going for mental health condition. They're like, what can a physician do for me, right? Mm-hmm. Other than prescribing medications, which they're probably not interested in. Sometimes they are, but oftentimes they're not. And so if you're sending any patient to me, the first thing for me is always about evaluation. So the difference about my practice is that it's designed specifically for people who need that extra attention. My visits start with a 2 to 3 hour evaluation. So it's important for me to actually get to know the patient. So that's whether you have autism or ADHD or you're very neurotypical. Like, everybody needs the time to tell their story so that I understand everything holistically. And when I can put the whole picture together, it allows me to give them the best treatment plan. So that's number where we want to start. And oftentimes, if, whether you sent them to me or not, if they've come to me and I can hear the whole story, I can then say, I think you might be neurodivergent, and do the handoff the other way. Right. But my job, once I figure that out, is to then provide them with the best evaluation possible. So if they're coming with the diagnosis, that's one step. Then we go into what are the comorbidities, my understanding of what the comorbidities are likely to be, even if they're unaware, even if they, can, not really pay attention to them. And so I'm able to go into what that may look like, whether they understand or have them or not. And so for me, I do understand when you're neurodivergent that it can come with other comorbidities. And some of the big ones are like your mast cell activation syndrome, your POTS, your Ehlers-Danlos, or just, again, joint laxity in general. What are some other ones?
The gut,
those are my
GI.
GI is a huge one. GI is a huge one. So I would probably say those are like the 4 big ones. But what I like to tell people is that just like the diagnosis itself, it's a spectrum. So you may not have full-blown mast cell activation syndrome, but you might have just issues with histamine and just being very sensitive to the environment. And so it may look like just regular sinus issues, but you have them to a degree that's a little bit more than others, right? Mm-hmm. So for me, that's basically like, we talk about comorbidities. We talk about, are they where they are, mild, moderate, severe, if they have them at all. Sometimes some of these come a little bit later in life as well, right? We don't necessarily see them super early. It just depends. And for me, that's, part of that initial evaluation. So get to learn the patient, figure out what they need. From there, depending on, again, if they're coming from you, I already know they have the diagnosis for the most part. Then we can go ahead. Oftentimes, they have the diagnosis of autism, so they come see you. And they're like, hey, they also have some ADHD.
Yeah.
And so we can talk about that. And again, for me, it's understanding if they have autism, that they may or may not do well on a stimulant. But again, by talking to them, sometimes they've already been on a stimulant. Sometimes, they haven't, and they can tell me whether or not it's affected them or helped them. Sometimes we do a combination of a stimulant plus a different medication to kind of help balance some of the issues that may come from having a stimulant. Sometimes it's not medications at all. Oftentimes, what I'm trying to do is actually treat the root cause of the condition. And so for my programs, it is, yes, medications are available. Supplements are another huge one that we use. And we also do TMS. And so that's really, for me, it's about the heavy lifting that I'm able to do in my office that other offices aren't able to do. And we combine all those things together. So I'm taking individuals and we are going to do, if they haven't had a neuropsychological eval, we make sure that they go get the neuropsychological eval. And then if they have, we take that information and we use it to have a better understanding of what parts of the brain may be an issue for them. But then we go a step further and we actually go get a QEEG for them. And a QEEG is going to let me know what parts of the brains are overactive, underactive, during wakefulness, during most likely sleep. And so it lets me know exactly how the brain is functioning. And then from there, I take that QEEG and then we create a program specifically for them to enable their brains to work better. So we do TMS, which is transcranial magnetic stimulation, in specific patterns, at specific frequencies for these individuals to improve how their brain is functioning.
Right.
And that is the biggest, that's the heavy lifting. That is what changes people quickly, right? That's what makes therapies more effective. So if they're pretty locked, if they're pretty rigid, we can get that to open up so much faster with TMS versus medications. And sometimes we still need medications, or sometimes we're always going to need supplements. Those are always, but sometimes we may need medication for a short term. The goal is to try to move away from medication, especially like any antidepressants or any anxiolytics. Like those aren't really necessary if we treat the brain first.
Right. So I want to backtrack a little so we can, because there's a lot of information and I know a lot of my clients would struggle being able to track that all. So first I want to go to, let's talk about the medication, because I know that we talked about that some last time and there was, a couple of things online I wanted to make sure we were addressing. But when someone comes to me and they have that ADHD diagnosis, and I will, usually see if, okay, we've done everything we can intervention-wise. This particular, whether it's a kiddo or adult, may need that stimulant, or I think they might, right? Or they've had it before. The practice generally in counseling is send them to the psychiatrist. I don't like to do that, okay? And I explain it to my clients this way. I would rather send you to a doctor that is going to give you that 3 hours to get to know you, every part of you, because again, I'm about that whole body, that holistic care. And if the medication, we don't need the antidepressants, anti-anxiety things like that, okay, I want to try to do it without that first, right? But I also want, to send them to someone that is going to do the blood work and do all of these things. That makes, you are monitoring these things. And then between you and I, we are looking for, any kind of side effects that come up or tics, and we're seeing it at two different levels, right? And so we're getting the self-report, maybe parent report, but we're also seeing it in office. And so that helps us really make sure we're covering all of it, right? But I will, encourage people who have previously gone to a psychiatrist to go see you instead, because I explained to them, I feel better about you going to see a medical doctor who's going to monitor blood pressure. And, because with stimulants, blood pressure should be checked. All of these things should be checked before we throw anybody on medications, right? And so I would rather have them safely go to you and have that done. So that's kind of something I wanted you to explain a little bit of, why would a counselor say, hey, we normally would go to psychiatrists, but I would rather have them go see you.
Right. I think, again, because my practice is very different, whether it's an insurance primary care provider or an insurance-based psychiatrist, you're going to get insurance-based care, right? That's just how it's going to be, which is basically what's your diagnosis and here's the medication, goodbye. My practice is inherently different, right? So yes, we're going to spend that time to get to know you, we're going to do labs that matter to you specifically. So I spend the time to get to know you. So I then will order, yes, my baseline labs. Then we're going to also order things that are related to what could be going on. So if I have a patient in front of me and I know that it sounds like they have mast cell activation syndrome issues, or they have like Ehrlich-Danlos, like we're going to get those additional labs, right? If I think it's POTS, we're going to get the additional testing that we need. And so I'm looking for those comorbidities. We're doing labs that matter, that actually don't cost people an arm and a leg, right? And we're able to do them because we do cut out the middleman. Like my labs are inexpensive. Like the way that I practice is just inherently different. And it's a better, safer space for individuals who need that kind of time.
Yeah.
And personally, I think everybody needs that kind of time, but especially neurodivergent people.
Yeah.
And then when it comes to medications, like stimulants were my favorite thing. Like before I even knew about the autism thing, and I just specialized in ADHD and highly giftedness, I was like, pro stimulants, put your child on a stimulant, because again, data shows that it reduces their risk of, getting on drugs. When people think like, oh, if I put my child on a stimulant because it's a controlled substance, it's going to actually like make them want to be on drugs. It shows the difference. Like if we put children on ADHD medications, stimulants, before they actually start driving, it makes it safer for them and the general public, right? And so, I loved stimulants because it made such a difference in the lives of those who were afflicted. And so, getting parents to understand that this is what you want to do for your child and not wait was a big thing for me. So I was definitely pro stimulants. And then I get a curveball and I started getting my ADHD patients and be like, hey, didn't work for me. I'm like, what? No, stimulants work. They're great. And then I had to really start to change, like they presented information to me, and I started to learn about how oftentimes, they genetically just are a little bit different. And so we have to change how we treat them. And so I use a myriad of different medications based on what and how they present to me in different off-label ways. So I will use, gabapentin, I will use guanfacine, I will use non-stimulant medications in addition to the stimulant, because the stimulant will help them in ways, but it may also affect them in adverse ways. And just depending on that particular patient is when I pick a different drug. Like we use some other narcolepsy medications off-label, right? There's a myriad of different ways that I can help balance some of their symptoms so that they can feel authentically themselves and not, give up having the ADHD part addressed. Because when you do address the ADHD part, it often relieves that anxiety, depression diagnosis that they came in with.
Yeah, one thing that I do want to clear up, and maybe you can explain this, because I know we've talked about it before, and I talk about this a lot in counseling, especially when there are kiddos, coming in and parents are really nervous about the addiction, right? Are these stimulants addictive when it comes to ADHD meds?
So here's what I would always say to patients who, again, because I told you, like, it really changed people's lives. They didn't have to struggle anymore. It was just a great, great option for those who truly have ADHD. Now, what I found is that people want to come in and tell me other people's stories. And I don't know anything else about anybody else. And so we always get in trouble when we talk about what other people are doing when we don't have the full picture. Right. So I always caution people to, unless you know the full story, don't tell me about what they, them, and the rest of the general population are doing. Unless you know them, you don't know the full story.
Right.
And so it's very hard for me to give professional advice to someone I don't know. Right. But I know the person in front of me, or getting to know the person in front of me. And that's where, again, we start educating them on, this is how your brain is working. This is how your brain is functioning, right? I am very careful to make sure that we have the right diagnosis, right? Which is why we use other modalities. I use other professionals to make sure that we have the right diagnosis. And again, just because you have ADHD doesn't mean that you won't have these other issues, like learning disorders or learning disabilities and other things that that go along with that. So we want to make sure that we fully flesh that out, which is why the neuropsychological evaluation is really important. But for me, what I would tell parents, oftentimes I've used it, I would compare it to like a child who has type 1 diabetes, right? And I think I got this from like an older physician, pediatrician actually, who, you know, again, their job is always trying to like tell the parent that it's safe and convince the parent that it's safe. And I would say, if your child had type 1 diabetes, would you not give them insulin, right? For a child who has ADHD, it's the same.
It's
right?
a medical
It is the same. It's because, again, their brain isn't creating the chemical necessary for them to function better.
Ironic that you use the diabetic, you know, analogy, and I do as well, because I have diabetes in my family, right, on my dad's side, and so I grew up with that, and so that is what I use to help parents understand it is a medical condition. And if your child had diabetes and you had to give them medication for that to manage that condition, would we not? If it could manage that condition, right? And so it is that. And oftentimes when I want, you know, my clients to go to the doctor, again, the same as, you know, they come to you and then we send them out for the right diagnosis, right, on autism, ADHD, or whatever it is, we understand it. I need to make sure that what they're presenting with does not have a medical component to it. And that's why I would then send them out to a medical doctor, right? Because a lot of, like you said, people are going to go, well, why do I have to go to the doctor for autism? I came to a mental health counselor. Well, that is why, because if we are doing our job as mental health counselors, we are ruling out everything before we say you have this disorder. Yeah. We want to make sure. So do they all walk in my door with that diagnosis? No. But I need to make sure they understand we need to get to that point so we have the understanding of what is going on with you, right? And we have your accounts of things, but what if there's more than what you've considered? Right. And we have this very knowledgeable, and I tell them highly gifted, you know, physician who, thank goodness, that highly giftedness it's amazing to watch when you are working in your field, right? And that's why I want them to come to you. But I also want to point out that your office space, it is a smaller space that is sensory friendly. It is not, they're not going to be, you know, treated as cattle with the waiting room with lots of other people. And that is not what we are finding in a lot of the bigger, you know, just the practices that are having multiple doctors and multiple things. It is very hard as a neurodivergent person to be around these other people that it's not comfortable. But coming into your space, it is by appointment only, and that makes it so that it is, you know, it's quiet when you go in there. Your office space, no matter what they're doing, TMS, they're getting their physical. You know, one thing I liked about how thorough you are is even in the weight loss world, you send out for extra, you know, finding out how much fat you have in your body, visceral fat, things like that I would have never even considered. But that's how thorough your care is, right? And that is exactly what neurodivergent, autistic, ADHD individuals need, is someone that is going to think of everything, right? And really design that to that person.
So we've talked about this before, that I said I designed my practice based on how I would want to be treated. Mm-hmm. So again, I don't like to wait. I don't like to wait. I don't necessarily want to be around a bunch of people, right? So my waiting room is I have a waiting room, but no one really waits, right? Mm-hmm. And then my appointments, I used to really despise how I had to practice before. Right? Mm-hmm. We're talking about scheduled every 15 minutes. Yeah. Every 15 minutes. Yeah. Every 15 minutes. And so I made sure that how I schedule patients doesn't really cause a lot of overlap. They may be back to back, but again, the minimum amount of time that you get directly with me is 30 minutes. That's the minimum. I don't have a 15-minute appointment. Mm-hmm. Yeah. And so no one's scheduled for less than 30 minutes. again, that initial is pretty long, but they're usually 30 minutes to 1 hour appointments. And they're, again, even if they're stacked, it's because it's me directly. There's no middleman, even in my office. Like the medical assistant isn't checking people in, wasting their time, because I didn't like that either. I was like, if I'm going to the doctor, I'd rather just, see, like if you have to do something as a medical assistant, that's fine. But when the doctor comes in, I don't want to repeat it.
Yeah.
I gotta order, so I don't like the redundancy. So I took that out of my practice. Like there is no redundancy. Mm-hmm. So if you fill out paperwork, I'm looking at it.
Right.
I'm reviewing it. All that other paperwork that was done before and other practices that I was in, I never looked at that stuff. I didn't know anything about their family history.
Yeah, but you are correct.
Hours in the lobby filling out all this paperwork that I was never gonna look at.
And it's not even the paperwork, just that. It's like when you have that medical professional that's doing all of the checking the weight and all of these things, and then they're asking you what's wrong, you go through this whole thing, and if it's a long list like mine usually were, I'm repeating it multiple times because I'm being asked, and then they're like, okay, and the doctor will be right in. And what's the doctor walk in? How can I help you today? What? And it was like, wait, I just did this with the nurse, and did they not talk to you because there was no time for them to talk? Then why even ask me? Let me save it till then because it was hard enough to gather my thoughts. And I'm thinking, whoo, that was hard. I did it. Oh gosh, now I got to do it again. So you're right. Having to say that multiple times, that can be really hard when you're going in and as nervous, right?
Or just, again, it was something that irritated me. So I was like, I get to choose to not do that to anybody else because that's not how I would want to be treated. Yeah. And so there's no need in my office for a medical assistant. I can check a weight, I can check a height. Like I only do that once anyway. And then after that, I'd rather check your blood pressure because I'm very particular about how I check blood pressures. Mm-hmm. And so I don't want to have to wonder or not if my medical assistant did it right that day.
Yeah.
Right. And then I'm having to repeat it anyway. Yeah. So let me just do it the first time. Right. And it takes nothing to do some, a temperature and a pulse. So for me, that's how the practice is set up, right? Which is why, like how you described it, it's because that's what would bother me. It's even to the point where I never liked going to get my, well woman exam and sitting there draped and just having to wait until somebody comes back.
Right.
It bothers me to no end. So for me, if someone's having to disrobe, or if I'm having to leave the room for any reason for them, there's a button, there's basically a doorbell button in the room that they can ring when they're ready.
Yeah.
Right. So that I can go right back in and they're not just sitting there waiting for me to figure out when they're done.
Right. And you're not going room to room to room to room.
Because there's no one else. Yeah, like that appointment, exactly. I have enough time. If you come in and there's a procedure, you're scheduled for an hour. If there's a procedure and an appointment, you're scheduled for an hour and a half, right? So it gives people, and it gives me, right, as another neurodivergent person, enough time to make sure that I have gotten everything that they needed done. Yeah. Or they've gotten enough time to actually talk. And it may be something else.
So I will say this. Now, I have clients who have selective mutism when it comes to certain things like being able to go out. COVID has made it really hard for individuals to advocate for themselves. So if there's an adult or even a kid, we're nervous. And one thing I will say that I have loved about, I encourage my clients, I'm like, reassure them, trust me, you're going to love her. And they do every time. And even if it's the clients where I have worked really hard to get them, to be able to talk to me, you're able to. And the first client that I've ever sent you, has been with me 3 years now and makes her own appointments with you, handles her own stuff with you, which is great. And that wasn't something she could do early on. But because you are so welcoming and understanding and right off the bat know how to get that person, to understand that you're there for them, that's been amazing for me as a counselor to hear that when they come back, because I don't always get that if they decide to go to that psychiatrist or to their pediatrician. they won't listen to me. And I'm like, yep. That's why I really do recommend Dr. Isom, because it's not about like, she's not about not listening and doing it her way. It's about hearing the parent, hearing the client, hearing the child, paying attention and being able to hear that. Whereas maybe other, clinicians are not doing that. And then that is brought back to me like, I just don't understand why they're not listening. Okay.
Well, they don't have time, right? It's not designed for them to listen.
Right.
Even though I recall being taught in med school that 90% of what we do is based on what we hear, right? It's the history. But we don't even have time to do a history. We don't have time to talk. We don't have time to ask questions. I always say it's the system. It's not necessarily the physicians, because we're trained to do the right thing for the most part.
I don't know.
No, like,
you're
special. For the most part,
you are definitely special.
I will say now that, I've probably said it in another episode that we were trained to practice insurance-based medicine. That's disheartening for me now. It's like very disheartening. The more that I reflect on like how I was trained compared to like what I'm able to do now. And it is all based on disease and coding. But in my brain, I've said this before, in my brain, I figure, well, I learned the basic sciences. They taught me the basic sciences. They taught me all the things about the body. And then they taught me about diseases. So if they taught me all the things before the disease and how the body works, then I must have learned how to fix the body. That's what I thought. And so I figured that's how we were all practicing, right? From the standpoint of how to fix the body, because we were taught the before and the after. So that's how my brain worked. And then I slowly started to realize as I talked to colleagues who were not understanding what I was doing and how I was doing it. And again, I've been told by colleagues that I shouldn't do a 3-hour visit. Like, I shouldn't do. I'm like, but I get so much done and understanding in that 3-hour visit, because what that patient comes in and tells me, in the first 15 to 20 minutes, they're basically telling me what bothers them. They're telling me what they understand their condition to be. It's not maybe for an hour or 2 hours later that I actually am able to put the whole thing together, because I'm able to ask the right questions to get the right response that helps me understand it better. Right. Because you can only tell me what you think I want to know or I need to know. Right. But if I don't have the time to actually ask you the right questions, then I'm not really going to get to the answer fast enough. This is why I'll get patients who have spent years, literally years, with the same symptomatology, because guess what happens? They go in, they see a doctor for maybe 7 or 8 minutes, who then sends them to another doctor, who then sends them to another doctor. And again, each doctor they have to go see is at least 3 months away. Yep. And so now it's easy to add up the months, and now you're in year 2, and you still have the same unresolved issue, where I can sit and talk to you. And honestly, this has happened more than once, that within 20 minutes, I have a really good idea of what the problem is and how to solve it.
Yeah, and so you probably use a lot of what I do. It's listening. And because one, working with an autistic individual or even ADHD, our brain could go a mile a minute or very slow. And so we will either forget very quickly what we were trying to say, right? Or we'll forget symptoms that we're having until something is discussed or a question is answered, and then it's like, oh yeah, that's right, and I did have this, this, and this. And if you're not, as the provider, willing to hear that as well, right? And you're just assuming, oh, they just want these things. They want medication, they want this. No, right? Sometimes we just have to listen. And so even for myself, I will tell a new client, you have full autonomy over your schedule. Go in and pick what works for you. But if this is an initial, even though my paperwork is very thorough so that I don't have to ask a lot of questions, because that's hard for an autistic person to have to answer a lot of questions like back to back. That's difficult. I want to make sure I'm there to answer questions, get the resources, provide that psychoeducation. And I tell them, okay, give yourself if you're going to book the last one of the night, make sure there's nobody behind you so that you can have that 2 hours if you need it, because it's going to need it for initial. It's hard to do it in a 60-minute time, which is what insurance want and which is what most counseling practice. It's all by the hour. And I'm like, just give yourself that time, because it's going to take that time. Right?
Yeah.
And it's the same for you. Do you find that just being able to have that extra time, it gives you time to hear those little things that maybe they didn't see them as a symptom, but your brain's putting it together like mine does of, oh, that's absolutely a symptom, but maybe of something else that you were not considering.
No.
And here's where I need you to go see Dr. Isom now.
It is absolutely the biggest differentiator for me. And so I have a lot of complex cases too. So I have people who have literally come to me after going to the best institutions we have in the country, right? And some of my more complex cases have gone to multiple institutions, right? So they've gone to the Mayos, they've gone to the Cleveland Clinics, they've gone to the UC, they've gone everywhere. And what I tell people the difference is time. It's not that I'm smarter. Yes, I am bright. But it's not that I'm smarter than these individuals. It's that I can give them the time, and I'm bright and I care. Right? That's the biggest difference. And so I'm able to go through all of the paperwork, and sometimes it's tons, and I'm able to fine tooth it. In addition, it's not just this, but it's also talking to them, because that is meaningless if I can't have a conversation with you and have a full understanding of what this path has looked like. And so I've had my most severe case, we needed 2 3-hour sessions to discuss everything. Right. Because again, she had been struggling for so long in so many different ways. And, it was still complex. It wasn't like, oh, this is going to be easy. But it was a lot of the things that I now know to be part of that, spectrum of comorbidities that come with these neurodivergent brains, right? And now I have an even better way to actually offer them treatments that are exceptional compared to what we've been able to do before.
Yeah.
So that, to me, that's why I won't give it up. Like, I won't give it up. I won't charge people, an extreme amount for it. I mean, I know people, especially in that functional medicine world, who are like, you get an hour with them and you get 3 months with them and they charge you $30,000. Like, that's not my practice at all. Like, my practice is, my practice is a membership practice. So again, I'm never going to be overloaded with patients personally, right? Again, that's where we bring on other physicians, and we're going to be training other physicians so that they can do exactly what I do the way that I do it, but never be overloaded either. Like, this is a win-win for everybody. Yeah. No one needs to be overloaded. I need you to be good at what you do so that we can help people be great at who they are.
Yep.
So for me, it's not like, I love my model. I will never change my model. It is what allows us to be successful. And when I mean successful, it's allowing us to get people to be the greatest they can be in emotionally as well as biologically. Like, I am able to move the needle so much further and so much faster than I've ever been able to do it in an insurance-based practice. So yes, time is what I think is the biggest differentiator of what I do. Yeah. Because now it doesn't take us 6-12 months to get to an answer. I can get there really quick. Yeah. When I hear everything. But if you don't hear everything and they say come back in a month, like for another 7 or 8 minutes, like, we're getting nowhere. Yeah.
And what I like about your membership, program is that if you do have to refer out for, whether it's this X-rays or CTs or MRIs or anything, that you do, you have put the time in to finding that affordably for individuals, and I say that if I had insurance and I had to have a CT scan, you have made that available to me through another provider for $200. Whereas if I was using my insurance, it'd be $500 to $1,000 deductible. And so that wasn't even with insurance, which you would have paid into all the time, wasn't affordable. And so a lot of those things, people wouldn't get that care, right, that they need because we can't afford it, right? Your membership has been really integral to me, like deciding how I could also make that membership available in counseling, which is unheard of. But you and I have worked together to make this happen so we can make it affordable for people to get care without insurance. And let's face it, a lot of insurance is getting more challenged with the way the world is today, right? And so even ABA is, people are losing their ability to get ABA because insurance is not covering it. It really has been very slim. And I can say as a person who had children who needed behavioral therapy, finding an insurance that paid for it was nearly impossible. And then when they did, it wasn't really paying for it. And so it's going to go away. And so that means providers like myself had to figure out how to make this accessible to people so they can get that. And in a positive way, right? That I can oversee that just like you and make sure people are getting the passionate care that, comes with what we do, and it's really about taking that time. And I told you this before, when you were in, insurance and I had insurance, you didn't give me that 15 minutes when I knew the requirement was that. You gave me an hour and a half. And from that point, I followed you, right? I tried it with the person who was after you, and I thought okay. And then when I did see, like I said, Isom MD on a wall, I thought, how many Isoms could there be? Let me check. And sure enough, it was you. I was like, I was at your door. I swear I had that membership that day. It was like, this is affordable to me.
Yeah.
Right. And there are a lot of jobs out there that people don't have insurance. And unfortunately, there are a lot of us that are neurodivergent that don't have insurance, right? There are certain things that can trip us up, and having that membership care, that makes it affordable. And that's something that I love telling, my clients, like, this is a one fee for a month. And if you need her more than once, you have her as many times as you need, right? And there have been times when, I make myself accessible to my clients. And I have one client that I was logged out of the system and they needed me. And when I heard that you were with that client, with them on the phone for 3 hours in the middle of the night, 3 a.m., I thought, this is exactly why I send people to her. I felt bad that I had logged out of one system and I was like, oh my gosh, but the doctor was there. Okay, I felt good about that. Yeah. And I was like, I am sending them to the right person, right? Because you have as much care and passion for individuals as I do. And it's not that they're going to need us like that forever. It's just in the beginning, right? And understanding in the beginning they will. But once we get you feeling better, you're not going to need us as much, right? No. And that's what's key.
And so post-COVID, there was a lot of medical anxiety.
Still is.
Oh, yeah. And so, that is a very special niche, right? Which is why my type of practice works, because again, it's unlimited. Mm-hmm. You pay your membership fee, you get unlimited visits, no additional copays. So those individuals who actually have that healthcare anxiety are in a lot. And so when you say, once a month, I have patients literally with healthcare anxiety who in the beginning, I was seeing them once a day. Then we would, we go down to, a couple times a week. We may relapse and we have to go back to almost every day again. And then we, over the, years, we've been able to move out. One person in particular, I'm thinking to myself, like, I'm a little concerned because I haven't seen, I got used to seeing them regularly and needing me regularly, that I'm concerned, is everything okay? But that's when you've actually helped, when they don't need you like that, and they're still okay. They're still gonna need you. You never not need a doctor. And though I am very pro having insurance. I don't like the way insurance is done. And the reason why we need insurance isn't for health care. That's a misnomer. The reason why we need insurance is to make sure that we don't go medically bankrupt, right? We need it so that for those high costing things like surgeries or hospitalizations, we don't want to go medically bankrupt having to pay for those things, because hospitals are expensive. There's really not a good way to make hospitals less expensive, because they're always going to rely on insurance. And anytime you add in those additional layers, it's going to drive up the cost.
Yeah.
My philosophy and the philosophy of being a direct primary care physician is that if we cut out the middleman, we can drive costs down, and healthcare, specific healthcare is not expensive. Health insurance, another ballgame. Health care, not expensive when you cut the middleman out. And we don't need the middleman to pay for everyday appointments. We don't need the middleman to pay for labs directly. We don't need the middleman to pay for imaging directly.
Right. And I think it's important to talk about when you have a doctor who is meeting your needs, who is understanding your brain, your body, your care. Sure, we will have those emergencies that, send us to the ER or that are requiring hospital stays. But I will be honest with you, when you took over my care, I had a lot less emergency surgeries. I had a lot less issues that laid me up in the hospital for a week, because we were now understanding. And it would be such a fight before of, no, I'm sorry, I'm still not feeling good, or no, this is still going on and I'm not getting hurt, until it would, I would be hospitalized for that thing, right? Now I don't have those issues because we are taking care of those things, right? And so that's when you have somebody who you become afraid of doctors, they're not going to listen, they're going to dismiss. And for an autistic individual, that trust, we struggle with that. And it can take a long time to earn that trust as a provider, especially in counseling, to earn that trust and to understand it's going to take a certain amount of patience to be able to get that trust from that client 100%, right? And so you've probably noticed in practice that they'll come to you with a couple of things, but they're holding back, and you can sense they're holding back absolutely. Until the next visit. And then you get a little more breadcrumbs, right? And then you're like, well, okay.
Because usually they come in for that initial and it's like 3 hours. It's hard to stay that stuck.
Yeah.
For 3 hours.
Because you're getting on the safe space. Yeah, and that's just it. It's
I do share the fact that I am also neurodivergent with them, if that's what they're in for. And I can tell, you can tell, what's cooking back there, and they don't know yet. It's scary. It's still a doctor's office. They don't know. And so they start to warm up, and I actually work really hard to try to get them to warm up.
Yeah.
And try to understand. And so, that first, even if they don't then they won't fully open up, I've at least left an impression that makes them comfortable enough that the next visit, it's very different than that first visit. Right. One of our shared patients, for sure, it was, there's very little back and forth conversation in the beginning. They didn't talk much at all. And then, I don't even know, it's been, a year or so later, and I see a whole different person, who will communicate with me, about their health conditions. And again, this is the same individual who came to me who had been told nothing was wrong with them medically. Nothing's wrong.
Yeah, and they had a serious medical condition.
We get labs done, and we're like, no, this, and this.
Serious stuff wrong.
All need to be addressed, and this is why you feel terrible.
Yeah, and so that's the thing that in the mental health world, especially dealing with autistic and ADHDers, that I have to be able to know what can present as a behavioral. So that was the vitamin deficiencies, the thyroid conditions, things like that. I know a lot of that because of research that, I stay up on, but also from my own experience, and then having my kids' experience and just family history, right? And having to learn about all of that. And so I can hear these things from the clients. I do have some that are really not wanting that label, right? And not wanting to have the possibility of being autistic or with ADHD. And I love that they'll go to you and I don't even have to tell you anything. The minute you come in there, within 5 minutes, you're like, have you ever considered being neurodivergent? I'm like, oh, thank you for that, because now I'm not the only one. But you catch it as quickly as I do. And I love that you also have the ability that I do, because people think it's strange that I can do this. I will hear them talk about family members or whatever, and I know. I'm like, yep, yeah. And then you'll confirm that, and that's without us even, collaborating on that case yet. And I think that's what speaks volumes, is that, oh, okay then, but just giving that time and having the passion that you do. I wanted you just to kind of also touch on the program that you've put together, because it is, and you don't have to go into huge things, but I do want you to talk about it, because I feel like you have really put in passion and time and understanding, right? And as a person who is sending my people that I am also passionate and just really trying to help to you, that speaks volumes to me. That means the world to me, because you have shown how much you care about the same people that I am taking care of, right? And so I wanted you to kind of touch on that entire program, just, that you put together, and what that means for you going forward, and for some of individuals coming to you, like you have said, you realize you have a lot more neurodivergent patients than you had thought about before. And you're like, oh, and I'm like, that's because one, we're sick of people not listening to us. And so we're going to keep seeking out the right person until we find them. And then they stop with you, right? Because you are the right person. And two, just because we tend to surround ourselves with people who are neurodivergent, because we see something and they're drawn to us. And like you said, you put together this program that is what you wanted to see, right? And then I keep telling you, I didn't do that because I sought out for something different, but it is what I ended up designing, but not for myself, but for the people I worked with, right? But for you, what is it that you've put together, and all this work you've done even over the last year to push care for autistic and ADHD, patients, to where you're helping them and you're gearing up for it, in a big way.
Yes. So where do I start? I start with, I have the devices that I have in the office for, other things. And the company came to me with a new device that came out. And so I'll listen, but I'm again, same thing. Like, I'm really not in the market for anything new. They know I don't do aesthetics, so don't come talk to me about something aesthetics. Mm-hmm. This wasn't an aesthetics device. So they come to my office and they're like, hey, we have this new device coming out. You're one of our top docs. We want to offer to you first. Can I talk to you about it? Sure, what is it? They're like, it's TMS. And I said, okay, tell me more. I said, okay. So we've done studies for, again, in the wellness space. So we're bringing it to market in the wellness space. We already know it's, FDA cleared for depression. However, we're bringing it into the space for people who are like overwhelmed, and people who are, anxious, and, people who want to quiet the food noise. So like binge eating and so forth. And I said, okay. And I said, yes. So they said it's going to be for the executive function side of the brain. I said, oh. Okay. So I know what you brought it to market for, just like the original device that I got. Like, I know what you brought it to market for, but now I'm hearing the technology part of it. I understand like the science behind it. Let me go figure out, right? If this is about 40 years in the making, right? We've been using the technology for 40 years. This is obviously the brand new version, the better version, got it, sleeker version, beautiful device. Let me go figure out what research is available for what I want to do for. Because as soon as he said it's for the executive function side of the brain, I was like, I know exactly what I want it for, right? I'm thinking selfishly, my ADHD. What can we do for my ADHD?
Right, yeah.
And at that point, I knew that a lot of my patients were ADHD. Again, this is before really adding in the autism. I had some autistic or identifying autistic ADHD patients. But for the most part, I knew I had, a good amount of ADHD patients. So I was like, okay, this can help me, this can help my patients, it can help my child. Go in with the research. And I was like, okay, the research is there, the data is there. I'm good to go. I am good to go off label. So I get the device and I'm like, okay, research off label. So I have this device and I'm going to use it off label to treat ADHD. And then that really morphed into, okay, what else can I combine with it? Because I want optimal. That's great. I can make the brain better, but what else can I do? I'm almost like, what else can I do? Because I'm like, how do I make myself the best? What else can I do? And then I happened upon, plasmalogen precursors. And I was like, whoa, this is amazing. Who knew this existed? All right, so that has to be part of the plan. What else can I do, right? I need data. So it's great that I can put this on your brain and we can talk about how much better you feel. But how do I map this? How do I tell, clinically, because I have DEXA scan for visceral fat and body composition, what can I do to the brain? So then that's when I decided, you know what? I'm gonna learn this QEEG. I put it down for a little while and then I picked it back up. So I was like, let me figure out how to get my certification in this. And I said, I don't have time for this. I want to, but I don't have time for this. So then I actually found a lady who actually does them. And again, like everything else, I have to go in, try it out myself, talk to them, make sure that this is the right thing for me and my patients. And I do it and I'm like, it's a good fit, right? For me not to have to go learn how to do this. So now we've added the QEEG. This dials it in 100% for me, right? So now I can actually see how the brain's functioning and then where exactly I need to place this device. Because for ADHD people, for myself, after one treatment, I was like, hey, brain is really clear, right? Multiple treatments, brain is much clearer. I can remember things a lot better. This is really great. I don't need Adderall. And I was a huge proponent of stimulants until I don't need it. All it does is keep me up. It doesn't really help me stay focused. My time blindness is not there. I'm aware. I just may choose to ignore it, but I'm aware. So it gave me so much more control than I ever had of my brain. So I'm like, I'm loving this for me. Let me give other people the same. Mm-hmm. But what I realized is not everybody responded the same way. They just didn't respond. I would have my predominantly ADHD people have that one treatment and feel amazing. I would have my less ADHD driven people not I don't know, maybe. And I'm like, what do you mean, man? I felt fantastic. Well, not in elated way, but I was like, oh, my brain is quiet. For me, it was actually pretty eerie. I was like, I don't know what this is. I've never felt this. This is weird and uncomfortable. Other people oh my goodness, this is great. My brain's never been so quiet. My more right-sided brain people didn't feel that way, right? Because again, I'm going by treating the left. That's kind of what the device is designed for. And I was like, what was the missing piece? Why aren't they getting? And I knew it was right brain. And so I had to go and learn how to, configure my device for them. Because again, thankfully the device allows you to change the settings. So I could configure it for the right side of the brain now, right? Not just how it comes packaged and ready to go. There's a way for me to edit the settings.
Okay, so let's explain right, left brain.
Okay. So in the simplest version for me, right? So I look at my left brain people as those who have ADHD type symptoms. So that's your mood, motivation, and I shouldn't say mood, but motivation, impulsivity, irritability, anxiety, depression lives on that side. Again,
and that's the right.
That's left.
Okay, I was going to say.
That's left.
Okay.
Right? This is the more defining way of looking at it, right? Okay. So right is going to be more of the rigidity, the OCD, the rumination, the darkness. That's pretty much, again, what I'm treating. That's what we're treating, right? We're not talking about, oh, your creativity, that's not what we're aiming to heal. So when I talk about right and left brain, I'm talking about people who are really sensitive, who have a lot of, again, stubbornness, rigidity, like that. Those are the things that really ruminate on the right side of the brain more than the left. The left is, we're going to get to, like, everybody needs right and left, but when people don't respond as easily after I treat their left side of the brain, they need way more work on their right than their left. And so that's where I was like, I need to figure this out concretely.
So that's the QEEG.
The QEEG allows me to see concretely.
Is that the brain mapping?
That's brain mapping.
Okay, so can you explain that a little bit so people can understand what that means?
So I send them for brain mapping, which is through the QEEG. And essentially you get all these electrodes on your head. It's actually a pretty quick test. You put the electrodes on your head and it tells you what brain waves, basically, again, which equate to like frequencies, are doing what where, right? So is it in the right side of the brain? Like, what is in the left side of the brain? Like, where are these? And it looks like a thermograph for the most part, right? It's like red, greens, blues, and it basically shows you how your brain is lighting up with these different wavelengths.
And before, you would have gotten that at a neurologist.
No, they don't do those. So there's a difference. There's an EEG.
Gotcha. Okay.
That shows me like the electrical, it's common like an EKG.
Gotcha.
Basically shows me like the brain activity to let me know, are you having seizures? Or are you having, like that's what it's basically telling me. It's telling me like more about like involuntary movement issues or disruptions in the brain in that sense.
Okay.
Brain mapping is this thermograph of your brain where it basically has like, reds and greens and blues, and it's lit up differently based on the brain waves. And so based on that, it will then conclude a lot of different things about you. Now, here's where I always tell people it gets a little bit tricky. So when you get the results from the QEEG, it will use words that are just basically one word descriptions of you. And so sometimes it is a game of semantics. It's like, I don't really identify with that particular word, but it may be more of a semantics issue. So it's not maybe that specific word that you identify with, but it's something similar in that way. So I can say, like, mine said that I wasn't very empathetic. And I kind of took offense to that. I was like, because I really care about what I do and how I treat people. But then I was like, well, maybe there's some truth to it in this way, right? And so I always tell people, like, that's nice information, but that's not why I'm doing it. But it does help identify some things so that we can, then come back and have a conversation about that. And that's also like using that along with like a neuropsychological eval, like you just get a whole, and plus obviously the patient's personal story, you get a lot of information that way. My job is the heavy lifting. It's like, now I know exactly from this brain map where the issues are, or where the connectivity issues are, or where the disconnect is, or what's using too much energy, what isn't using too much energy. And now I can balance the brain.
Okay. Right.
And I balance the brain using the TMS device that now allows for those neurotransmitters to flow better, because it improves connectivity for the brain. So I don't change your brain. I'm not changing the structure. I'm not changing the number of cells you have. It's not harmful in any way. And it produces really great results that aren't based on medication. So now I can't take that result away from you. Like, now you can't take away the fact that my brain is better and my memory's better again than it was before. Like, you can't just take that away.
But that brain mapping allows you to individualize that care. And I like that, because that,
because none of them are the same.
Yeah, and that's the biggest thing, is that we're not always going to have the exact same thing. Each brain is different, and each autistic brain is different, right?
Very
and
different.
In the autistic world, if you've met one autistic person, you have met exactly one autistic person. And so I like that mapping is going to show you those individual brains, and you can do the care to that.
Yeah, that's the fun part, because again, like, going through them, it's fun to see, like, some people I'm doing right and left same day. Some people I'm gonna be doing right for the next 8 sessions before we even touch the left.
Right.
And some people, again, and I'm just saying right and left, but it's different aspects of the right and left. So sometimes it's more frontal, sometimes it's more posterior, sometimes it's more lateral, but I get all of that from the brain map.
Right.
I get all of that from the brain map. And then again, being able to use it, again, it's off label, but it's not without studies. Like we're already like, the evidence is there. We just haven't been using it in that way.
Right. And I think I like that about both of our care is that we spend a lot of time researching, doing the studies, because we recognize that working with this population, we have to, because, you know, things are changing and what may have worked before didn't. And even if something is like, oh, this is tried and true for this, it doesn't mean it's going to help that individual. So like I tell people, I have to have an eclectic approach. I can't just say I'm going to do this one modality, because that one modality doesn't work for everybody. And even if it works for a lot of these things, it doesn't work the same for everybody. And I can't give homework to people that don't want homework or don't do well with homework. Or, you know, some people are like, give me homework. Great. But I have to get to know that person first. Have to get to know their brain. And I think that's even clients that are coming to me or parents that are bringing adult children to me or young children to me. It takes time to really get inside and understand the individuals, how the brain functions, how that affects their emotions and their reactions to the world, and all of these things that for me as a counselor, I have to understand all that before I can ever give them this treatment plan or give them these things, and then I have to test those boundaries, right? And I have to see what is that brain reaction. You're having to do medical care, and this mapping is great. And the fact that like with our clients, that's something that is important to me, is to making sure that we are collaborating between, you know, providers. And the same, you know, you guys will get to meet Dr. Mihalik, the psychologist that does the assessments now. You know, I worked a long time vetting out other people to get to the team that we have now so that we can have this exceptional care for everybody that walks into one of our doors, right? And we're sending each other back and forth. And so just having that and now doing this wraparound service, it's key to understanding and treating the whole person, brains, body, sensory issues, all of it, right? And so having that has been crucial. So I am excited, you know, and I like the way your brain is. You are not going to have other people do what you're not doing to you. And there was a time when I came to your office and I said, I'm having a hard time explaining this procedure to my clients and really saying, because the way my brain works, if I haven't done it for myself, I can't speak to how that's going to be for the client, and I don't feel comfortable with that. And you're like, oh my gosh, my brain works the same way. Let me do a treatment on you. From that point on, I was like, I get it. I understand it. Now I can put it into words. But my brain does not work unless I try something first, unless I know what it feels like. Because my clients are going to ask me, well, how does it feel? And how is this? And how is that? And I don't know. Go ask Isom.
It could be
that wasn't okay for
people.
Yeah.
When you talk to them about doing something to their brain.
Yeah.
When they don't really understand it. And again, once this device came out in March, it is the first time it's been commercially available, meaning that if I don't feel well and I don't want to take an antidepressant, I can go pay to feel better. I don't have to take your medicine anymore.
Mm-hmm. Which I know studies show that antidepressants, most of the research is on kids, right? But it shows that antidepressants and anti-anxiety meds don't always help an autistic person. And so having something like this available is crucial, because me having to explain that, well, this doesn't, and they're like, well, what does work? Well, sorry, but the studies are showing this doesn't, you know, and you know because you've tried it. For a kid, an antidepressant is a sedative, and that's what we're doing, right? And so it's not, I usually have to explain, it's not the same part of the brain that needs to be for an autistic person. Yeah. And so having this available, I have seen my clients that come in with severe PTSD, CPTSD, where we are working on just understanding autism and their sensory issues and what that means for them. But then the PTSD is kicking in and it's overriding that. And then it is contributing to those sensory issues, making them bigger, and then which makes that feel bigger, right? I've had them go to you. They did a couple of treatments. And when they walked back into my door, one of them, it was amazing because she said, I always say, how do you feel after the first one? How do you feel after the second one? You always want to know what they're feeling, if they notice a difference. And she said, it stopped all the PTSD stuff and the CPTSD stuff. So I can just focus on what it means to be autistic. And I thought, that's amazing. And I've seen it with the child who, I've worked with quite a bit, and school has been a real challenge. This child is highly gifted, but can be combative, right? With insecurity and stuff like that. And so, lots of lashing out with mom, especially when there's a lot of big stressors. And so I recommended, let's try this because we're already doing medication. And I don't want to keep throwing new medication at a child, right? Especially some of the autistic with severe ADHD that are more aggressive, right? Physically aggressive. And so when you did just one treatment on this child, for the first time, and the only thing that changed was that one treatment, nothing else has changed. I get a message from mom who was about crying because the teacher reported that she's doing her work in class and didn't want to go to resource room. And I was like, what? We had to set up resource room because she wouldn't do her work in class. One treatment of that, and there she was. And I said, the only thing that's different is we did this one treatment. And that has changed this child's trajectory in school. She's highly gifted, but she was so worried about, her rejection dysphoria was getting in the way. She would do the work, but she wasn't sharing that she was doing the work. And she was afraid to participate in class because she didn't want to say something wrong or be corrected or whatever. And so she didn't, but that stopped it. And now she's excelling and she's happy to do the work and she's doing it in class, right? And I think that, to me, that speaks volumes.
So I'll tell you what I've noticed, because I do children, obviously.
Mm-hmm.
Now, you've said that I do children, and I do. The youngest is 6. The youngest I'll go is 5. In adults, but I have noticed, though, in younger children, including my own daughter, is that 1 or 2 sessions for them, because they have these more plastic brains, so to speak, moldable, transformable brains at that time, they tend to have effects a little bit longer. Yes, it takes multiple treatments for you to have that dialed in neuroplasticity, right? But you still get a positive effect. And so, my story about what happened to our family last year with my former husband, who had committed suicide, again, because of his autism, right? Mm-hmm. I offered him the service and he didn't do it, right? He wanted to do things his own way, and unfortunately something else happened, and that was just the last straw for him. Our daughter, who then had, 2 really, really bad days. She masked during the day with friends, fell apart at night. The next day, that evening she cut, because I let her go to bed by herself. And that evening she cut, but she told me the next morning. Mm-hmm. And as a mom, forget doctor, I was petrified, right? Busy during the day, masking during the day, came apart that night, again. So we spent the night in the closet. We spent the night in the closet because there was no way I was letting her out of my eyesight. It was just late. I got her the first thing that morning. We went to the office. I gave her treatment. Since that day, no issues with wanting to commit suicide or something. Like none. That was like her issues for 2 nights in a row. And that second night, it was so scary because it sounded so familiar. Like he committed suicide while on the phone with me, and I heard all of his, ranting and how I couldn't get through to him. He just wasn't listening to me. And I felt the same thing in her that second night. And I'm just like, I can't make this make sense for her. Like no matter what I said. And again, like my autism kicks in and I can only answer truthfully because that's the only thing I know and indirect. And she's not trying to hear that. She just wants to die and be with her dad.
Yeah.
And so again, for me, I'm like, there's no way. And the way I survived is because I had multiple treatments of the TMS before. Before I had to encounter that situation, right? And so my brain was more resilient. Like which I didn't understand until like well after the fact of like, how am I getting through this? People are like, how are you getting through this? I'm like, I am. I'm not saying it's easy, but I am. And people were concerned that I wasn't dealing with the issue at hand. And the same thing, like even you got concerned, like, well, maybe she's not talking about it anymore. That's kind of scary. But no, it was gone. It was gone after that first one, and it's never come back. And she is well-adjusted. She's happy, right? We've had other treatments and they've gotten better. It's like I have an 11-year-old preteen who I say is amazing now, right? She's like way different than that pre-hormonal, pre-TMS kid that I have. Even before like her dad committed suicide, she was that preteen that you just like, I'm ready to choke you. And now she's amazing. Right? We still haven't had like a whole lot of treatments, but they seem to be lasting. And when I seem to like, it wears off a little bit, I'm like, oh, let's go get another treatment. But I haven't brain mapped her either. But like, that's what, again, because it was like, I just need to cut this.
You needed to do something quick.
We need to do something quickly. But people said I should give her medication. They suggested medication because she was so distraught. And even I was like, I don't want to do that.
I didn't necessarily agree with that either. And so that's the thing. I don't want to throw medication in at first. And I explained that to you, I think the other day, that even in the mental health world, I don't want to throw medication. I will try everything I can to work them through it until I see that whatever we are working through, whether it be a past trauma or whatever the case, is too deep. And the wound is so deep that it is, making that functioning at home or in other environments that much harder. Then I will say, okay, let's consider that, right? But again, I wanted them to go to the right provider because I don't want people taking medication without a plan to get off that medication. Because I'm like, what's the plan? No, there isn't. Wait, what? Then they're wrong, because we should never have it as an indefinite thing. It's there to help us get through those tough things. But like I tell my clients, even if you're going to go on this, I will let you know, like, when I'm seeing that maybe it's time to consider not taking it. You've got through this thing, you're doing better, maybe it's time, right? But work with your provider, your prescriber is what I tell them, to get, don't just cold turkey, okay? But just doing that, another patient that we share, same thing, the rumination was real and the obsessive thoughts and, all of these things, and then started going down that dark path because that rumination is there, right? And so one treatment of TMS really helped. I see a difference, right? Complete difference. And to me, that makes a big, it's a big difference in my practice. Explain for people who may not understand what TMS is, because they're going to go, what does that mean in like the understandable terms for patients, clients?
So it's a device that is going to stimulate the nerve, the cells, the neurons, right? The cells of the brain in a way that allows them to grow or improve their connectivity. And when you grow and you improve connectivity, then you improve outcomes. You improve how you now respond. You improve how the signals that they emit or transmit go from cell to cell to cell. So we look at them essentially like a road, right? And some people's roads have potholes. And what we do is we basically fill in those potholes, right? Some people's roads just stop. And so what we do is we go in and we can pave them in. Some people have roads that are just so hardwired the wrong way that we need to kind of go in and break them up. And so that's how we again, that's where like the different frequencies work, and that's the different patterns that we use and the different sides of the brain. And so we know by brain mapping what roads need to be paved in, what roads need to be broken up.
And how are you stimulating?
Stimulate. So it's magnetic stimulation. So again, there's magnetic coils in the device that emit the energy to stimulate the cells, right? So it's not electrical. It's not like that old ECT type therapies where we're shocking people.
And that's what I wanted people to understand.
Yeah, it's super, and again, especially in this particular device, it's super comfortable. You're not strapped in. We should have a picture we could put up there. It literally just lays on top of your head. Yeah. There's no strapping you in. You could do it sitting up or laying down, which I like, because again, depending on how the patient presents, especially for children, sometimes, again, I've had to do children just sitting up because they're not comfortable laying down. Sometimes we do it with them laying down. Lights are always pretty low. There's mellow music in the background. There are weighted blankets, or sometimes there's fidgets, like whatever is going to keep them there. We don't expect them to always, go the full 24 minutes. And oftentimes, especially if I brain map them, sometimes it's not. Sometimes the treatment is significantly less, but the settings are very different. And so you can get really good therapy. It's not about the time, it's the settings that I'm delivering. What type of energy am I delivering? And so it's a very comfortable procedure with the device that we have, where it's painless. There's nothing that breaks the skin. Most people go to sleep. It's a tapping.
Yeah, it's a light tapping is what it feels like.
It's just a light tapping. It can be a stronger tapping at times, but it doesn't cause you pain, right? And so we always make sure that we're adjusting the level so it's always comfortable, and it's not like how much energy can you take, it's what's comfortable for your brain, because that's the setting for you, or that's the intensity for you. So again, magnetic stimulation of the nerves in the brain that allow for better communication.
Yeah, and I think that for myself, like you had mentioned earlier, that people are like, oh my gosh, it's my brain. I'm very protective of my brain, right? And so it was part of in the back of my head, like I don't want to change anything that I want to keep. Like this other stuff, I want to, sure, quiet that down or whatever, but I don't want to change my intelligence and how I problem solve and all those things. And so that's when I kind of, brought it up to you, like, hey, these are the concerns that I have, right? Because I need my brain to do what I do with my clients, and I need the superpowers of my autism to help me do what I do with my clients very well. And I was like, tell me what this means. And so when I was able to experience that and understand it with how you explained it, okay, that made sense to me, and now I can explain it, right? And I know that when I send them to you, you're going to be able to explain it to them, and however their brain processes information, and that's what I needed, right? And a lot of times, even if it's an adult child that's coming to you, their parents are the ones that you have to, that's the barrier you got to get through, right? And be able to do it. And I think, we've done, one of these events together. And I remember, having this person in front of me talking about their child. And I said, wait a minute, you need to talk to Isom, because I'm telling you, this she can help. And she's like, but nobody else has been able to. I'm like, but she can. I understand that. Like, I know. And right away you were like, yeah, absolutely. And I was like, phew, I was right. That is something, even this significant condition, that this device can help. And that creating that connectivity is key. Yeah. Right. And I will say this, yes, that is a major part of what we do, but it's not the only part of what we do. So I always tell people, yes, the device is amazing, but the device alone isn't what's going to get us the optimal results, right? So again, it is, understanding the right labs to evaluate the situation, because that part's important, so that we can provide them with the right supplementation, depending on what that looks like. It can be peptide supplements, these amazing supplements called, plasmalogen precursors, right? Amazing things that we can do in order to, again, facilitate better neuroplasticity or better brain connection, right? And the earlier you do it, the better, even the right lab evaluation, understanding what we're needing to look at in order to get them the best results possible. So yes, devices are important.
But again, part of that heavy lifting is, the right evaluation, the right supplements, or sometimes it's also the right medications. But again, I look at medications mostly like Band-Aids or bridges. I prefer them to be bridges.
Right. That's exactly how I see it.
But if sometimes we have to use it, a Band-Aid, I'm still looking to pull the Band-Aid off at some point.
Yes, thank you. Yes, exactly.
Right. And unless we just can't. Right. And again, these aren't necessarily inexpensive options either. So that's why, you've talked about people having like 1 or 2 treatments. And again, it's not ideal. It's not the full treatment, but it's helpful. And so my thing is, if nothing, I've had patients who were feeling suicidal and I'm like, come get a treatment.
Yeah.
Right. It isn't going to, create the most optimal outcome. But what I know we're going to be able to do is stop that immediate part I can get them to the office. And I have, and they're like, oh.
I don't know if you can explain this in a way. Let me see where I can go here. So I know that we talk a lot about inflammation in the brain and we talk about how the brain is functioning, but can you talk a little bit about how sometimes or often with autism, it can cause inflammation in your body and how that ties together with the gut
brain,
and all, the research that you've been doing and how we're going to be able to help those things. Because I know for myself, that's a huge thing, right? Is all this inflammation that gets caused by, and I know now, like, it's my autism that these things start with that, and having you understand that, and you understood it before you even went down that path. Like you understood it, right? And so, kind of, if you could just explain that.
So let me see if I can simplify. So, we always talk about gut permeability, or they call it leaky gut. It's inevitable. The two are highly linked. Again, I look at like my younger brother who, as a little grade school kid, first day of school, that anxiety kicked in, the gut, stomach pain, first day of school, but he gets past the first day of school, he's fine. But inevitably, he always had anxiety triggered abdominal pain. Every year without fail.
And for some kids that could be throwing up.
It could be
anything. And so understanding that is,
it can be diarrhea, anxiety. It can be a lot.
From that.
But anxiety is a brain issue. Right? Anxiety comes from the brain. You don't control that. Right? These are neurochemical issues. You don't control that. And so that connection is undeniable. Right? And you can see it manifest in different ways. What I like to say or do for people, especially in the neurodivergent, I'm like, again, we want to make sure that we address the gut, because once we address the gut, it makes everything else work a lot better. It feeds back to the brain and vice versa. But anything that you put in your mouth has to go through your gut. So whether it's medications or food, I'm going to make everything else work better when I can heal your gut. And I have some really amazing cases of, again, like complex cases where people they've done the functional medicine, because I don't do the let me pump you with a bunch of supplements. I don't do that. I have a very different approach. And it's way more effective. Now, if I need to go down to do we need to really figure out the exact organism, that we can do that. But what I know works is how we approach it. And without having to necessarily do expensive testing, right? I can hear enough of the story. I can figure out which route to go, which program to put them on, and we heal the gut. Because again, what I found out pretty quickly is, yes, that data is nice, but it wasn't really changing my management. I was like, here's what I need to do, or here's the first thing we need to do. And then if we need to do something else, then we can. But this will heal most people's gut issues, unless they have severe dysbiosis, where it's just severe gut overgrowth in certain areas, or they have severe yeast overgrowth. But oftentimes I can kind of look at the belly, because I'm used to doing the cardiometabolic side of it, where we're looking at the gut and visceral fat issues and body composition. So I can usually tell when a person has major gut issues, because the stomach looks very different, it's shaped differently. And so even if they don't tell me, I'm going to have a discussion about gut. And so having the ability to treat people's guts treats the body in general, right? It reduces inflammation. It allows, different fluids to stop passing back and forth. And like people have like different swellings and aches, and like it gets to joints. Like it affects the body as well as the brain. Like it makes our brains foggy. What I do like to caution people about is that it's not a cure-all, right? It is a first step. Right? To make everything else down the line better. But it will resolve some things. But when people are like, well, if you treat your gut, then it just heals everything. There's nothing. And like even what I do, I'm never going to tell someone that this one thing is the thing. Everything works together. I may do the heavy lifting, but there's so many other things out there to help for like maintenance and making things better. Again, like it's never going to be one thing. I always say everything has some utility. Right? Red light therapy, cinnamon, berberine, like whatever sound bath, everything has utility, but how much utility, right? Like if it's something minor, if it's something major, you got to use the right tool for the right issue, right? So for me, again, gut brain is, I've simplified it just because it made my brain feel better. Right. And I'm able to treat my patients like faster to get them feeling better, and then we can, pick up whatever little pieces are left. But it significantly helps facilitate the rest of the body healing and the brain healing. But when we don't address the gut, we're really leaving a big piece unsolved, and it makes things a lot murkier when I don't address the gut. So almost everybody, unless they're showing a pretty fairly healed situation, because again, based on like some of the symptoms that they may have, I'll be like, oh, that's related to your gut. That's related to your gut. Oh, we need to heal your gut. Or I could just look and say, okay, we need to heal your gut. And then it makes everything else, downwind easier. Like it takes some things off the table. So now I'm looking at a clearer picture. So when I don't heal the gut, when I do heal the gut itself and the gut permeability specifically, let me talk about it. Because yes, there are bacteria in the gut and things like that, but it's really that gut permeability that's the bigger issue, right? And that is caused basically from inflammation, right? So there's various types of inflammation. So when people say inflammation, it's variable. Yeah. Super variable. There's vascular, there's cellular, like there's inflammation, there's tissue, there's so many types of different inflammation. So, but permeability issues in the gut are the biggest issues that people have that causes additional problems. And when I heal that, now I've corrected a lot of those things and I can see what's left.
Right. The process of elimination is, And I can say honestly that, I wish I had met you in 2003 when, I was 33 and my gut issues were starting then. And so it was a lot of things. I mean, to even going so far as, the acid reflux, allowing them to put, go into my throat and put little doors in there to keep things down rather than figuring out what's causing that. And now I know I've eliminated a lot of things out of my diet that it turned out I had this allergy to, right? And not necessarily the food, but the components that were going along with that, right? And yet we put a device in my head, right? That is like, but just how many tests have I had? Upper GI, lower GI, this, it scrapes on my stomach, looking for lupus, looking for this. And yet they would say, nope, you don't have that. But no, what do I have then? Right? What do I have? That's 2003 when it started. It's now 2026, right? And I've only been feeling better for the last 3 years, right? And when you and I have been working on this, really understanding it, and I've been able to change those things, where I don't have that issue, and I don't have to keep going in for all these tests, and insurance wants this step to this step to this step, and it's a checklist you got to do, and that's hard. When you're the patient going down the checklist, do your checklist. I know what's next. You're still gonna find nothing, but And that's one of the most frustrating things, to see. That's one of the beauties of being out of insurance medicine, because I do use
peptides. I do use supplements. I do have an amazing herbalist that I work with. Because again, these are things that I'm very interested in, but I don't have time to go back to school for this.
But your brain is like mine. The first thing we think of is, I'll learn that. And we can.
Yeah, but
then we're like, wait, we don't have the time really to do this and that. And so now, you have to be able to find other people that can do that. But like you said, going to that person, making sure they're going to do it for your patients the way you need them to, and not just, I'm sending you here for this.
No, the secret sauce is finding people who are neurodivergent in their field. I will take a neurodivergent person any day when they're operating in their passion. Any day. Now, don't ask them to do something else, but if it's the thing that they're passionate about, any day. And I have been very fortunate to work with people to help me with my patients who are that way. Like I make referrals for other things, when people aren't passionate, it's just because you have to. But when it comes to things that I am passionate about, the things that I do care about, it is important that I work with passionate people. And I've been fortunate to be able to provide that for my patients. So, I don't have to go the traditional route at all, right? I do use peptides. I do use supplements, right? We use medications as well, but it is not the only tool for me anymore. And so this is how, again, I, as a medical physician, will address autism and ADHD beyond just, especially for ADHD, beyond just, hey, here's your stimulant. Right?
Yeah.
Autism, they're usually like, what can you do for me as a medical doctor if I have autism?
Right.
And I'm like, hey, do you realize that these other things can be afflicting you because you have autism or ADHD?
Right. And it's the same thing that I do in counseling. And I usually tell people it's not cookie cutter, because my clients aren't cookie cutter. And I don't want them going to a doctor where that care is cookie cutter, because they're not going to be that. And so I need to make sure that people understand that and know that when they walk into my office, they're going to get something like they've never gotten. They're going to get a therapist who goes above and beyond to understand that brain, design their care to them. And that may take me time, but I will get it every time. I will understand. And I've had parents be like, you really do get my child. And when I'm given the opportunity, I will do everything I can to understand how to get through. And it may not be the way that I can guarantee you it's not going to be. I don't do anything like anybody else. And that is part of my spiel. I am a no BS person. I am not going to sugarcoat it for you. And I'm not going to lie to you ever, because that's hard for me being autistic to lie. It's hard. I won't do it. It just doesn't feel right to me. So I'm not going to sugarcoat it. If that's what you want, it's not here. I will be honest with you. And sometimes that's brutally honest, but I will get those results, and they may present differently, but they will always present, and they may present at different times, but I will do everything I can to understand my client. And that means physiologically, mentally, emotionally, every part of how their brain processes information, all of those things, which is why Dr. Mihalik was so necessary, because that helps me really understand what's going on, right? And then you are helping me understand the other part, and working together, we're able to provide that for our patients, clients. In a counseling, it's clients. For you, it's a patient. I think psychologists, clients too. So that one person is getting real wraparound care that they deserve, right? And everybody is able to give that, and not in a cookie cutter way, because cookie cutter, that is not me. And I'm not a 9 to 5, and you're not a 9 to 5. And a lot of times we're working until midnight, 1 a.m., but that's because we have a drive and a passion to help push that barrier and help our clients that we need to. And that may mean I get a case that is not like one I've ever dealt with. I'm up doing research so I can make sure I can understand, is that really a thing? Is this related to autism? And I'm having to find, okay, yeah, it is. And now I have to understand it well enough to provide that information to my client in a way they can understand. And for me, sometimes that's 5 different ways in a session. And if they're still not understanding it and they message me, now I got to find another way to say it until they understand it. And so I will do that. I will not get frustrated with that. And I will just keep doing it until I can see that they get it and they understand what I'm trying to say. And that can't be cookie cutter either, because again, their brain processes information differently. And if there's a parent, their child is processing different than them, and the other parent and whoever else is coming near this person, everybody's brain is different. And so I have to really break that down and understand. And so like you help me with that on the physiological part, and Dr. Mihalik helps when it comes to that psychological part. And so that I can really go, okay, now I'm going to, from what they've told me, what you've told me, what she's told me, now I can really start to even do a treatment plan. I won't do that until I have all the answers from where we need it, right? And so that's important. And if it was insurance care, I wouldn't be able to do that. You got to have that treatment plan. One visit. You cannot work with an autistic person and have all those answers in 1 or 2 visits. It doesn't work like that, right?
I cringe now. I just cringe.
Right? And so I did. And so I, coming into the mental health world and the way that we're educated to be certain amount of things, I just have to put that into my paperwork and into kind of that disclaimer of, I'm not going to do it the way that it's been before. But I also have to understand, and you as well, that there's a lot of trauma from other providers that we now have to also wade through, right? And offer reassurance that I'm not going to be like them. I hear you, and I will adapt and I will change. And that, the patient that you were talking about, who has given me the okay to say, discuss her case. The one thing that she told me when I was talking to her the other day was, you are the only therapist who has ever adapted to me. And I was like, okay, good. I'm glad that I was able to do that. But that's what it takes. And I was willing to put that time in. And this was someone who couldn't talk for 4 months, 5 months of working with them. But I always tell my patients, I'm not going to give up on you. And if other therapists have fired you, I'm not going to fire you, because that's what they're afraid of. Mm-hmm. And you could be mean to me, and I'm still not going to fire you. And I usually just tell them, you'll be back next week, right? And we'll keep going. But if I know someone is upset at me, it's because I've pushed that envelope a little bit, because I've said something that is honest, but it was something that they didn't want to hear at that time. But usually they'll think about it and come back in and go, okay. And I'm like, they leave, and I think, well, maybe they'll be back, maybe they won't. And they always come back. But it's because they know from that point, I'm not going to lie. I'm going to say what, is honest. And what the spiel that I give them in the beginning is 100% real. And I'm going to take that time to learn them. And I like that you do the same thing. You take that time to understand, and you're very matter of fact, like I am. And we have to adapt that sometimes, but for the most part, it works. And if I try to paraphrase everything for my autistic clients, they're going to see right through that. And they will, and they'll usually tell me, yeah, that's why I came to you, because I'm looking at them like, why are you paraphrasing what I'm saying back? I know what the problem is, right? Just tell me if I'm crazy for feeling this way or thinking this way. And when I'm like, well, nope, there are real, things because of autism is why this thing happens. They're like, oh my God, you get it. Yeah, because I'm there, because I am autistic with ADHD, and I've lived it, and I've watched it in my children, and I've watched it in my grandchildren, and I have a whole lifetime of generations where I've listened and I've heard it and I've seen it, to where nothing is too crazy for me, right? It's just not. Nothing is so out of the norm that I'm like, okay, I can see that, right? I'm never going to dismiss, and it may seem off the wall, and that's when I'll do more research, right? And I know that you're the same way, like, that's a thing. All right. Oh, yeah. Let me understand that. And it's like, oh, it is a thing.
Again, autism got put in my lap. I wasn't going to look for it. It was never in my purview at all until it was coming up. And like, I had some pretty brilliant autistic patients who were telling me things about themselves and having this understanding that they're doing the work and they're doing the research and they're sending it to me, and I'm going to read it.
Right.
I need to understand as well. And so if you're trying to learn and figure it out, let me understand it too, because I only understand one aspect of this. And so I'm really not about repeating the wheel. So I always tell people, I don't like to repeat the wheel. So if it's something that's working for you, let me know, help me understand. If it's something that doesn't work for you, help me understand. Because what we don't need to do is go back down that road because it didn't work.
Right.
Like, I'm not going to say, well, you should try this again, as if we're going to get a different result. It didn't work for you.
No.
We're going to move and we're going to find something different.
Yeah. And it is about results when it comes down to it.
Yeah. For me, because again, that's what I want. For me, I don't want you to waste my time. I don't want you to not believe what I have to say. Like, I'm pretty honest with you, but again, it's not your job as a professional to figure out whether I'm lying. You just believe, like, again, that's how I was trained. Like, you believe what the patient says. You can have some doubt in your brain, but you have to treat the patient as if what they're telling you is the truth.
Yeah.
Not go off with what you think is. And again, and certain things, maybe because I'm literal, certain things I've taken away from med school and that have just stuck. Like, history is important. I don't want to work harder. You tell me everything so that I don't have to work as hard.
Right.
If you can tell me all the things, 90% of my job is done, well, I'm going to listen so that 90% of my job is done. I'm not going to make it harder for myself, therefore making it harder for you. What's the point?
Right.
So I don't do that. Again, I want people to believe me. Yes, I can be, I don't like this. You say brutally honest. I like to think of it as being, I say empathetically honest or sympathetically honest, but brain math says I'm not empathetic. I don't know. But it's because I care. And I always tell people,
literally honest. Your brain works in a very literal way.
Yeah,
it's not a bad thing.
And so, I mean, so much so that my poor child said to me, she said, can you just lie to me to make me feel better? And then one of the most traumatic times in her life, that's what she says to me. So that, like, again, that's like me hearing something I don't want to hear, and I can only give you the truth. Like, no sugar at all. My friends, when I tell my friends that, they're like, you could have said that differently. I'm like, in the moment, all I had was the truth. And that's how it came out. Like, there was no extra to this. Like, no, that can't happen. What else do you want me to say?
Yeah, and this is where she said, Mom, I'm a kid. Just lie.
And
just lie to me for a second, because this is like too much.
It's too much. It's like, here I want to feel a certain way, and you're just giving it to me.
And so that is where, like I tell people, even if it says you're not empathetic, it's something you can learn, and you learn that at different times in your life. And it's not something that you're never going to have. You just learn how to apply it where it needs to be, right? And to be able to reach people in a way that they know you get them. They know you get it. It may not be a circumstance you've gone through your own self, right? But hearing their story and then trying to understand, that's what people want, right? But that's what I do. And then I got to weed through that very quickly. Like, I have to just really do the whole thing in my head of, okay, how much of that is like, and if I'm thinking, I usually tell people, if I'm hearing something you're not saying, I'm going to ask you about it. If my brain is telling me, I'm gonna call you out on it, right? I always tell them, if you're going to BS me, I'm going to catch it. And then I'm going to say something about it. Usually that's when they respect me more, because they're like, oh, she wasn't lying about that. But that's what I wanted, with someone that's going to be honest. When I tell people, hey, some of my superpower is that I remember all those conversations from the time I'm 3 on, which is how I was able to help my mom with dementia, because I remembered everything she told me throughout time. I will have teenagers who are highly gifted trying to trip me up, right? And I'm laughing. And I'm like, you could keep trying to do that, right? But I know, I can sense it. I know when there's a BS going on. I may let you think you got this, but I've already got that, and then I'll come back with a different way to approach it. Because in that moment, I'm not going to just unravel it all. I'm going to, oh, that's cute, right? And then I'll come back later and go, let's talk about this in a real way, right? But I have to deliver that to the way that person understands it. And so that means in the moment, I've got to know, okay, hold this one back, and then come back when they're ready to receive, right? The ones that are testing me, I have to be able to call them out on that. And they just kind of laugh, like, I said, I know what you're doing.
See,
I'm gonna let you do it, right?
I stick to medicine because I like to just be data and factually driven.
But yeah, you're science driven. And like, I've had people go, why don't you want to be an ABA? I said, BCBAs, they like the data. They like the charts. They like all of that stuff. Not so much. I like to be the RBT who's delivering what that person has put together as a program. But that's because I don't want to collect. I don't want to do all the data analyzing. I'll collect it all, but I don't want to analyze it all too.
Oh, that's the fun part for me.
You would have been great in that, because that's what makes a good BCBA is someone 9 times out of 10 neurodivergent who loves that analyzing of the data. I do analyzing in a different way, which is a lot of stuff that I have to analyze emotions and feelings and thoughts and all of these different things that can make up the mental health world. But I didn't set out to do it with autism and ADHD. It is kind of what, like you said, it kind of came to me, and I couldn't deny that there was this need and that this was a population that I am a part of. And so I had to start designing my practice to help this population. So my place is sensory friendly, and because I do details, I've thought of every detail I can, but that doesn't mean that I was able to get everything. Right. So I will still adapt. There are people don't see behind the scenes. I'm changing the couches and all of the covers and everything, getting different colors. If certain people like certain colors and I don't have that, then I'm changing that and I'm adapting that in between clients and whatnot, so I can make that person feel important, that I heard them, that I see you, and that's one of the biggest messages that I send is, I see you, I hear you. Yeah. I will make adaptations until I can reach you, right? In a way that's going to be helpful for you, not in the way that I think is going to be helpful, right? And I explained this recently to a family. I don't have any goals I don't even have a treatment plan for this individual. I don't have goals. I may ask certain things, but that doesn't mean I've said this goal, or I may push a boundary, but that doesn't mean I have a goal for them. I have to understand them, and I have to understand where they are in order for me to get to a place where I can help them. And if I don't push the boundaries sometimes, whether it's with parents or with that client, I'm not going to be able to do them a service, right? I'm not going to be able to help them or really understand their brain. So I have to push that envelope sometimes. And that may make them uncomfortable, but sometimes that has to happen before change can happen.
Not always.
Right?
You always have to get uncomfortable before you can grow.
Right. And so if we eliminate that out of it, I'm not doing my job. I'm not making any changes or making life better for that person. If we stop treatment before we get to that point, okay, that I know that person's going to come right back in after, when they need it again, or they realize, oh shoot, they stopped too soon. But I get it. I understand how hard change can be, especially for autistic individuals. And so that's what I want. Yes. I think my clients to understand is I get it, how hard change is.
Oh yeah.
And I'm here to adapt, and I'm here to be flexible while I'm helping you understand that sometimes you got to adapt and be flexible too. I'm willing to do it first, and I'm autistic too, but I know that's what's needed to make a difference, right? And so, yeah, I love it that our brains work the same, and that we will put that time and effort in to making sure that we're doing everything we need to do to help people, to help them change their life, if that's what they want for the better. And let's face it, when they're coming to us, that is what they want. It may not be what they've always experienced with other people, but there is a reason they're not going to those other people. There's a reason that they have sought us out, and they've come to us because we're putting that time in, and we have results, and we have, this way of doing things that helps us help others.
And that's for me, it is, understanding that it takes time for people to to garner the trust, especially for what I do, like, in the neurodivergent program, because it's new to them. It's novel. It's like, why haven't I heard about this? Why am I not,
why am I going to a mental health counselor who's sending me here to hear about this?
What do you mean? It's all of these things. But I'm like, I am over people thinking that we can't make things better in a real way. I am over having people just accept that, it's autism, severe autism, and we're not going to be able to make this person actually have a quality of life, some independence. Like, all those things are so possible now, but it takes a multidisciplinary approach, right? I can't do it by myself. You can't do it by myself. Having just a psychological evaluation is necessary, but it doesn't move the needle by itself either, but it's a starting point. Like, all these things matter. And I've had patients who've done testing, not the right testing, but they've done some testing. They've gotten ABA therapy, but they have no plan to get better.
Right. Yeah.
It's just, we're just going to provide them support with no real plan to get better. And whether it's neurodivergence, whether it's obesity, diabetes, no matter what it is, science and technology has gotten so much better. Yeah. That we're able to do things that we weren't able to do before in real ways to give people quality of life they've never experienced before. So like, my job now is really about education, whether I do it or I have someone else do it. Like today, I had a patient and I'm literally, like, I reached out to my rep. I'm like, hey, this patient has like a child on the other side of the continent. Well, not on the continent, but on the side of the country. And do we have somebody over there who has a device? Right? Because, again, I can't treat everybody. Right?
Which is a hard pill for us to swallow.
No, it's okay.
And it's like
I can't treat everybody.
I can't do it all myself, which is why I need other people to help.
But when you have
being able to spread that out,
excellent at what they do, I don't have a problem taking my hands off. I don't have a problem passing them on. Like, I am glad to do that. Like, I don't want to be somebody's therapist. This is not what I do, and I'm not good at it. Because what am I? Too literal, too real, too honest. Like, it's got, hey, I'm with this person. Oh, you should probably not be. Like, I'm gonna tell you, because I'm not a therapist. I don't have to do that. I'm giving you an opinion. I'm based on my life experiences, that of others. And so, but again, I will be that listening ear, but I'm very clear with my patients, like, I am not a therapist. What you get from me is my opinion, because you asked for it.
Right.
But I don't want to do that. Like, I want to have, but I've always believed in therapy, but I always tell my patients, like, you want to like your therapist more than you like me. Because you have to trust them in ways that I don't have to necessarily deal with. I can and I will, but I am not the professional for that. I would prefer. And when you have people who can do that well, I don't have a problem saying, please go see Tammy.
And even like we've talked about, like you said, self-disclosure. That's something in the counseling world that we're trained not to do. And like I explained to you, there's no way that I have to, because sometimes, especially even with the young kids, because they're looking at me or any adult like, this person has no idea what I feel. And when that kid is quiet and they're, going through something and they may think I don't understand, and so they're just have a reluctancy to talk about it. When I can tell a story about when I was younger or something I'm going through that's similar, I see it every time. Kids, teenagers, adults, where they give you a look like, oh, she gets it. I'm like, yeah, I do, right? If I didn't have self-disclosure, right, I know how to do it tactfully, and I know how to be able to do it in a way that it's like, okay, I may even be able to tell you this is too much, right? like this is tough for you. Here's this thing happened to me. To where that person will go, oh God, mine's nothing then, right? And I'm like, okay. Or I have to also be able to hear a client say, and I get it a lot. It's funny because I have to test the barrier with some people who are very literal, it's about me. And yet they need to hear that self-disclosure in order to help them understand themselves, because they're not, and they're thinking they're the only one that's going through something. And so I'll say it and they're like, that doesn't help me. Okay, I get it. And then later on, we end up having a conversation and I had to explain to him why that was relevant. And they're like, oh, I get it now. I'm like, yeah, so I have to be able to explain that in a way that they can understand. But I'm very methodical, right? In my self-disclosure, I don't just willy-nilly throw it out there. And that's what we're taught. It's not about you. And again, it's not about your opinion, but it is about, I understand this is really hard, right? And you're looking at me like, there's no way you understand. And I have to go, well, I do understand how this is for me. And, we're even taught in counseling to say, I may not understand what you're going through, but I can imagine that's hard. That does not work with autistic clients, because believe me, I tried it when I first got into counseling and they were looking at me like, did you just say that to me? And I'm like, okay. So I had to be real. And so I will, tell people I'm going to be real with you. And I will be honest with you. And if I see you're struggling, I will let you know how real I will be so that you'll know it's okay, that it's safe here. And I will always remind, this is a safe space. Yeah. I'm not going to judge you, right? And that's the biggest thing. And so adapting that, we do have to, when you're doing what we're doing right now, and this is not necessarily all uncharted, but it is a day-to-day thing uncharted, because it is still new things come up every single day when you're working with neurodivergent people. And not because we're difficult, just because the world is throwing so much, right? Yeah, that it's like there's a lot to it. And so we have to stay always researching. I'm never going to go, oh yeah, I have this CPT and that's what I'm going to do for the rest of it. No, that's not going to work. I have to have, a bunch of different things. And so even in my practice, musical therapy, art therapy, all these different things, animal assisted therapy, because there's so many different people I'm working with. And so I have to be able to, to know, and believe me, I will know. And I was explaining this the other day, like I have multiple dogs that I can utilize. And if one's like, I know I want this dog, and I'm thinking in my head, I got a better dog that is going to work with you. If we don't have that flexibility and that dog that you're choosing is not doing what you need it to, and I know I have a dog that's perfect for what you need, sometimes hear me out and let me just try this. And it usually will work out well, because I'm learning you and I know my different dogs and the different levels that they are and their personalities and how that's going to work, right? And it's not meant to replace, talk therapy or anything. It's meant as assisted, to assist taking some of that stress and strain and worry by, distracting the brain with something else, right? And just kind of making that therapy fit that client, no matter what it is that we're doing. I have people who are like, she playing Uno. I'm like, I can tell you 1,000 different things. I just taught your individual by playing Uno. There's a lot of different things I'm testing with that. It's not a game of Uno. There's a lot of social things. There's a lot of how their brain works, a lot of how their skills are as far as like communication, their math skills, all of that. I'm assessing all of that during a game of Uno, right? And so I have to be able to do that. And thank goodness that my autism allows me to do that type of thing and to get it very quickly, like soak in that information and then make that work, right? So I think for me in the counseling world, it's about understanding that trust needs to happen. But then if you're bringing a kiddo, I don't care what age that kiddo is, the parent trust that you brought them to me for a reason, and I'm here to help, and I'm here to learn your kiddo, and I'm here to take whatever time it that we can to help that client, to get to whatever, goals we have. And I will take what you're telling me you want your goals are, but I want to hear what this person, even if it's a child, I want to know what their goals are too, because they have to feel included in that decision. And I have to get that buy-in in order for it to work. So it's still an interdisciplinary team, right? And then I take it even into the schools, and it has to be this whole wraparound service.
You do a lot of that extended, care and assistance for your patients, right?
Yeah, it's a lot of case management outside of just that 1 hour session, and yes, it's an hour. It's not 50-minute like the standard, because I used to tell people there is not one autistic person that can sum it all up in an hour, or 50 minutes. That isn't going to happen. I'm pushing them, they're pushing me to the hour, and then I got to go to the next person, but it's never cutting them off or, right. Things like that. And it'll be the type of thing where someone needs that. Then I will say, and I'll message the next person, I'm running 5 behind, 10 behind, because they know it happens sometimes, and we will make that happen, because I never want someone to leave in a crisis and me go, bye, an hour gone, bye. Yeah. The next person understands, because they're also neurodivergent, and they've been in my seat at some point having the same crisis, and being able to give them that is important. So yeah, it is a lot of outside case management that people don't understand, and I think for both of us, research and just figuring out what is going to work for this person. And then when someone comes in and everything that you were taught might, and it doesn't, then you got to go further and figure out how that's going to work. And me going, give up is never going to happen. Right. And so I'm going to keep going until I can figure that out and help in whatever way. And with Dr. Mihalik, we're going to have her in here at one point, but then we're also going to have one of her individuals that works with her, who has designed an entire education program to teach educators about IEP and whatnot, and it's exceptional. And her name is Jennifer, and we're going to have her on as well, because it's going to be really instrumental to kind of pushing that needle forward, and like I said, I can't fight every school. I'm one person. I need this to be a team, that can do these things to make this change that needs to happen.
And I think that is the goal in general of, what we're doing is, how much can we really educate people for optimal results, and what that really looks like? What does a real evaluation look like? What should it encompass? What does treatment look like? Right. And again, we've laid it out. It looks very different, but it is not independent. It is not one particular service. And so being able to find the right team, even if you have to find the right team on your own, and that team isn't necessarily connected like we are, right? Knowing that you need a therapist who really understands autism, because that's difficult. I was going to therapist after therapist that never really understood how my ADHD fit into my life, right? Yeah. And so I'm unraveling every time we move, and they don't factor in my ADHD at all.
Right.
Frustrating, right? When you're, doing therapy, when someone doesn't really get how your brain works. My personal organizer gets, I've gone through many. The one that I've had since I moved here gets how my brain works. Others want to force you into doing things. So again, I've been able to create teams for myself that don't necessarily work together. And that's what I say for other people. So if you have, yourself or your child has autism, then you want to be able to build a team. And so tonight, I think is a good example of us explaining what that could look like. Even if you have to go find those individuals yourself, you want to know that that person has a passion for what they do. And they are outside insurance-based medicine for the most part, because I don't think it works well within insurance. It's just not going to happen. Somebody has to prove to me that it can happen. Yeah. I haven't seen it.
Because insurance-based, what I have found, especially in the counseling world, if the person is 5 minutes late, 10 minutes late, you got to send them packing and you got to have it rescheduled. Okay, in the beginning, because an autistic person is going to be nervous and anxious and all, they're going to be late, right? When they're going through something, they're going to be late. If I was throwing them out every time, let's reschedule, guess what? They're not coming back. And we lose our opportunity to help, right? They're like, oh man, you know how hard it was to walk in the door to get myself here. And now you're telling me I got to go. And that gives us too much of a constraint for that client. And so doing it this way allows me, to say, hey, you can have a 60-minute, you can have an hour and a half, you can have 2 hours, whatever you need. And if that means you're here and there's nobody behind you and you need an extra, there you go. I'm here for you, what you need, right? I'm not going to go, nope, that's done. And so that's where it gets hard for autistic individuals when they only have that 15-minute doctor appointment and it took them an hour to be able to communicate with you. So I will have an hour session and it could take them 55 minutes to get up enough nerve to start talking. And then I'm like, I got 5 minutes now we're doing this, right? And so it works if it's someone that like there's nobody behind, then I'm like, okay, tell me about that. But then I will try to figure out how to get them there a lot quicker. But in the beginning, that's what it's a lot of. And it takes them this warming up every time until they're very comfortable and then they can start out the gate. But it takes time. And so if I wasn't able to be flexible with that, I wouldn't be able to help anybody. If it was insurance, I wouldn't be able to.
Yeah, no, your hands are just too tied.
Yeah, they're
even
tied.
Like there's services that I can deliver. So TMS, the type that I provide, is not going to, again, because it's off-label, it's not going to cover me treating someone with autism. It's not, even though I'm treating like maybe the OCD, the rigidity, whatever, it's not going to cover that. It's not going to cover me using it in my weight loss patients. Mm-hmm. It's not going to cover me using it in my patients who've had automobile accidents and they have like this PTSD reaction now. And now it's a little bit unsafe for them to drive on the road because they're nervous. And so again, they can't just get that right to make them better through insurance.
Because they won't approve it. Yeah.
Right. But when you say the cost of services compared to what the outcome is, people have this belief that it's super expensive to do, that it's very expensive to take care of themselves. And basically, when you cut the middleman out, it brings costs way down compared to insurances. And so for me, that's basically the message that, health care, especially for neurodivergent people, is not going to be done well within insurance-based practice.
Yeah.
And I will say that with my full chest, 10 toes down, like, that one you would have to show me. Show me where that works, right? Even in the best systems, right? The best systems in the country, show me where that works.
Yeah, even
because they can't do the TMS on you.
Yeah, it took me a very long time to find an occupational therapist, physical therapist who will see an adult for sensory issues or things that we're still struggling with, right? And I recently had a client go to one and utilize her insurance, and after a few times, without actually meeting goals. And I know this because I'm still giving occupational therapy tips and tricks to help, like the weighted vest and things like this. They released her and said, you met all your goals. And I said, well, whose goals did you meet? And she was like, I don't know. Like, that's what they told me. And I said, well, what that tells me is you were utilizing insurance. Your insurance okayed you to pay for X amount of visits. You met those. And rather than that person rewriting it, saying there is still this need here and being able to explain it in a neurodivergent way, they chose not to. And so we've released it. I'm like, but I find that hard to believe because in the time you've been seeing the occupational therapist, which is why I wanted you to go to them, I'm still helping you figure out your sensory issues and how to help them. Right? Thank goodness I was trained by a really great occupational therapist up in Portland when working with autistic individuals, because that has helped me get them started. And I'm sending you to the right professional, but the professional's like, you're good. And I was like, yep, I know what that was. That was insurance. That said no. And so rather than, try to explain how this works, so I'm gonna hire an occupational therapist that we can offer that in-house and just do it the way that, the adult client, the teen client, the child client needs. Because sensory issues don't stop as children. They don't. Goes throughout your life. And sometimes we need to go back and learn new ways or, as we get older, our sensory issues tend to heighten. And so, that our ability to handle that stress gets smaller and smaller, and sensory issues go up and up. So we may need to go to occupational therapists to handle something that we didn't realize we had before.
But it goes back to everyone needs to fix their brain.
Yeah, exactly.
It's all brain down. We do improve the brain, especially as we're getting older. Then we have, the best chance possible of being able to have those therapies work even better.
Yeah. And think about
it. Doesn't eliminate the therapies. It just allows the therapies to work even better.
Right. But think about it for individuals like you and me who have come to this diagnosis late. That is, now we have to understand, we have to backtrack and understand how these things have presented as they're presenting today. Break them down to, did I have this before? And how does this look? And oh man, okay, this is how PDA is presenting. Now I understand it. It's a lot. And so for an adult to figure this out, maybe they might have gone through, when they were told as a kid, sensory processing disorder. They don't remember that, right? That autobiographical memory issue comes up and they're like, I don't remember my childhood, right? Bits and pieces, but I don't. And so they need a refresher and they need these things. And then regression happens sometimes. Again, inflammation and whatnot can cause that, but we need to be able to go to someone who understands an adult too, especially if you're coming to this late going, that's been it. It's a lifetime of that's been the problem. That's been the issue.
It's a grieving process I've learned with people that I will identify.
And that's how I put it to them. It's a grieving process and everybody grieves differently. And even if, say, the child gets the diagnosis, the parent has their own grieving process they go through, that kid goes through it. And so they really do need someone to help them all navigate, because they're going to go through it at different times for different reasons. I missed it. How did I miss this in them? Blah, 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 blah. And then, this child's like, I can't believe it. And if it's an adult, they're like, why did my parent miss it? And I have to explain to them, it is a grieving process. It is something where they didn't know they missed it because it was normal. Like we talked about, our families are all like that. It's just normal. We pass it down. It is not their fault they missed it, but they're also grieving that they missed it. They're just, you may not see that, but they are beating themselves up and they are doing that, especially because we are neurodivergent too, and going, right? How did I miss that in my kid? We love this kid. We know everything about this kid, but we missed the key thing that could have changed. And that, for me as a parent, helps me where I go, oops, I know what mistakes I made raising my children, and I know why, and I get it. But that doesn't make it okay. But that's how I can help educate parents of not to make those mistakes and how their kids might feel about that. And at some point we'll have my kids on here. They've both agreed to come and just kind of talk about that, what it was like for them, how hard it was when we were having those battles, and they each went through them differently. And I can't tell you, I apologized to my daughter until she said, Mom, stop. You raised me, I was safe, everything was good. I'm like, yes, but I feel bad that there were certain things that I just did because my parents said this is the way it's done. And then there were other things that I did very well, but certain things I am going to take accountability for that, right? Until they tell me to stop taking accountability for that. I'm like, okay. But that's all part of my story, part of their story, part, my clients, to help them understand themselves, is just to kind of show them, I get it. I've been there. And I've been that parent, and I've gone through this grieving process, and I'm still going through what it means to me, and what PDA is, how it presents in different ways. And when I can share that, with others, that helps them understand, that I'm not broken. And I always tell them, you are not broken.
Absolutely not.
You are absolutely not broken.
And there's
not something
wrong
we need to
with you.
Fix you. We just need to help you.
It's about improving, right? Yeah. It's about improving. And everyone, whether you're neurodivergent or not, can, stand to be improved, because again, like I say, our bodies are just one big batteries, and we're in at a certain age, we just start to decline. And so we need to be able to replenish those things so that we can, end up 80 and upright and enjoying life to the, our fullest. So at this point, I guess we can wrap it up for the night.
Yeah, I think so.
We hope you've enjoyed this segment, and we'll be back for more.